Have you ever noticed that your feet don't have a normal arch while standing? Do you always have a dull ache in your feet after a long day? If so, you could have flat feet. Flat feet, also known as fallen arches, is a common condition that occurs when the arches of the feet are low or entirely absent. In a typical foot, when you're standing, there's a noticeable arch on the inner side, which is that space between your heel and the ball of your foot. But if you have flat feet, that space is either very low or completely missing. So when you stand, the entire sole of your foot touches the ground. The big problem here is that this arch isn't just for show. It's a crucial part of the foot that helps distribute your body weight evenly across your feet and legs. Think of it like a spring that helps absorb shock when you walk or run. When this arch is missing or insufficient, the entire sole rests on the ground, which can alter the way you walk and place strain on other parts of your body, such as your knees, hips, and lower back. In terms of prevalence, flat feet is incredibly common, affecting approximately 20 to 30% of the population worldwide, with varying degrees of severity. While many individuals experience no symptoms, others may face challenges in daily activities due to pain or mobility issues. Types of flat feet. There are actually two main types of flat feet, and knowing which type you have is crucial for proper treatment. Number 1. Flexible flat feet. This is the most common type. When you're sitting or standing on your toes, you can see an arch form, but it disappears when you stand normally. It's like your arch is there, but it collapses under your body weight. Number 2. Rigid flat feet. This is the more serious type. Here, the arch is absent whether you're sitting, standing, or on your toes. It's like your foot is permanently flattened, and this type often causes more pain and mobility issues. Causes of flat feet. Understanding why flat feet develop can help you prevent the condition from worsening or even help you avoid it altogether. Here are the main causes. Number 1. Developmental issues. In some cases, the arches fail to develop during childhood. Most children are actually born with flat feet, but the arches typically form by age 6 or 7. If this doesn't happen, the condition may persist into adulthood. Number 2. Posterior tibial tendon dysfunction. This is one of the most common causes of adult-acquired flat feet. The posterior tibial tendon supports the arch of the foot, and when it becomes inflamed, weakened, or torn, it can lead to the gradual collapse of the arch. Number 3. Age-related. As we get older, years of wear and tear can weaken the posterior tibial tendon that supports the arch, causing it to gradually fall. Number 4. Injury or trauma. Damage to the foot or ankle, such as fractures, ligament injuries, or tendon tears, can weaken the arch and lead to flat feet over time. Number 5. Obesity. Extra body weight puts additional stress on your feet, potentially causing the arches to collapse over time. Number 6. Medical conditions. Arthritis, diabetes, and rheumatoid arthritis can all contribute to the development of flat feet. The hormonal changes and additional weight during pregnancy can cause the arches to flatten temporarily or permanently. Number 7. Genetics. A family history of flat feet can increase the likelihood of developing the condition, especially in children with flexible flat feet. Symptoms of flat feet. Living with flat feet can feel different for everyone. Some people might never experience any discomfort, while others might deal with daily pain and mobility issues. Here's what you might experience. The most common sensation is a general aching or tiredness in your feet, especially after standing or walking for long periods. You might notice pain specifically in your arch area. Some people describe it as a dull, persistent ache that gets worse throughout the day. This pain can also radiate to the heel, particularly in cases where the plantar fascia is inflamed. The plantar fascia is simply a band of tissue running along the bottom of the foot. When you have flat feet, it usually gets inflamed, causing pain and discomfort in the feet. In more severe cases, people also experience pain in their ankles, as these joints have to work harder to stabilize your feet. You might notice your ankles rolling inward when you walk. This is called overpronation. The discomfort doesn't stop at your feet. Since flat feet affect your entire body's alignment, you might experience pain in your knees, hips, or lower back. Some people notice that their legs feel more tired than usual, even after moderate activity. Some individuals may notice that their shoes wear out unevenly, with excessive wear on the inside edges. This is often a telltale sign of flat feet and overpronation. Some people also find that their feet feel stiff, especially in the morning or after sitting for long periods. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of flat feet. Diagnosing flat feet typically involves a combination of physical examination, medical history, and imaging tests. Your doctor will start by observing your feet in both a standing and non-weight-bearing position to assess the presence of an arch. They may ask you to walk to analyze your gait and look for signs of overpronation or imbalance. In some cases, imaging tests like X-rays, ultrasound, or MRI scans may be recommended to get a clearer picture of the bones, joints, and soft tissues. These tests are particularly useful if the flat feet are rigid or accompanied by pain, as they can help identify underlying causes like arthritis, fractures, or tendon issues. Treatment for flat feet. The good news here is that flat feet can often be managed effectively, even if they cannot be entirely reversed. Here are the most effective treatments. Number 1. Supportive footwear. Wearing shoes with good arch support and cushioning is often the first step in managing flat feet. Look for footwear with firm midsoles and a stable structure to provide proper support for the arch. Avoid flat shoes or high heels that lack adequate support, as these can worsen symptoms over time. Number 2. Custom orthotic inserts. Orthotics are specially designed shoe inserts that help support the arch and improve foot alignment. These inserts can be customized to match the unique shape of your feet, reducing pain and pressure on specific areas. Over-the-counter insoles are also available, though custom orthotics generally provide better results. Number 3. Stretching exercises. Stretching the calf muscles and Achilles tendon can relieve tension and improve flexibility in the foot. Exercises like calf stretches, toe stretches, and rolling the arch over a small ball can help reduce discomfort and strengthen the muscles supporting the arch. Number 4. Strengthening exercises. Strengthening the muscles in the feet and ankles is critical for improving stability and supporting the arch. Heel raises, where you lift your heels off the ground while keeping your toes planted, and picking up small objects with your toes can be effective exercises. Regularly incorporating these exercises into your routine can make a noticeable difference. Number 5. Weight management. If weight is a contributing factor, losing weight through a combination of healthy eating and regular exercise can significantly reduce stress on the feet and alleviate symptoms. Maintaining a healthy weight can also prevent the condition from worsening over time. Number 6. Physical therapy. A physical therapist can teach you specific exercises and techniques to improve your foot function and reduce pain. They might also use treatments like ultrasound or electrical stimulation to help with pain management. Number 7. Medications. Non-steroidal anti-inflammatory drugs, such as ibuprofen, may be used to manage pain and inflammation associated with flat feet. These medications can be helpful for short-term relief, especially during flare-ups or after prolonged activity. Number 8. Surgery. Surgery is usually a last resort and is considered only for severe cases of flat feet where other treatments have failed. Procedures may involve repairing or reconstructing tendons, realigning bones, or fusing certain joints to stabilize the arch. Recovery from surgery can take several months, but often results in improved mobility and reduced pain. At the end, remember, flat feet affect everyone differently, and what works for one person might not work for another. In some cases, it may not be causing you many symptoms. Now, we want to hear from you. Have you ever experienced pain or discomfort from flat feet? What solutions or treatments have worked best for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.